we've got all of our things tech all sorted out. Okay. Um, and okay, great. So we can continue on. All right. So first, before I start, I have to tell you what I'm drinking. So I'm drinking some black English breakfast tea with a dash of almond milk and a little ginger. So, I'm Indian. We definitely do a lot of teas and chais. That was my inspiration for this title. So, I'll throughout the year, as I sample different chais, I'm going to tell you about it as well. So, ginger is super anti-inflammatory, so good for gut health. And so I try to include it in my chai. Okay, so today we're going to be talking about cervical cancer awareness. January is Cervical Cancer Awareness Month. And I do so much of this day in and day out in my practice. And so I want to answer some of the, most frequently asked questions that I get. And so let's get started. So what exactly is cervical cancer? Cervical cancer is cancer of the cervix, and the cervix is the tip or the opening into the uterus. So when a gynecologist is doing a speculum exam, when they put the speculum and open it up, they're trying to see the cervix, and that's where we get some cells, and we send it off to the lab to check for any abnormalities. And this is a screening for cervical cancer. So that's what cervical cancer is, and it's super, super important to screen for it. So we're going to talk a little bit about that later on in the show, but let's start answering some questions. So what causes cervical cancer? The good news is cervical cancer is one of those few cancers that can actually be prevented. Now, cancer is a scary word. Many times, we are caught unaware. My aunt was diagnosed with breast cancer, or my sister was diagnosed with colon cancer, or whatever. We all have stories for ourselves and our families where cancer catches us unaware. But cervical cancer is not going to catch you unaware. It is one of those cancers that can be completely prevented. And the way you get cervical cancer is through HPV, or human papillomavirus, not to be confused with HIV. But this is HPV, human papillomavirus. It is an STD. It's a sexually transmitted virus. 60 to 70% of American women actually carry it. And oftentimes it's silent. So you probably don't even know you have it. You may not get any symptoms from it. You may not have any pain or bleeding. But the one way we can actually catch it is during our cervical cancer screening, when you see your GYN. So after age 30, we actually start screening for for HPV, and cervical cancer screening itself starts at 21. And so after 30, women should be getting screened for HPV. And if you have HPV, depending on what strain you have, there's high risk strains and low risk strains. The high risk strains are the ones that we're concerned about that can cause cervical cancer. Then there's further follow-up testing that we do. But essentially, in a nutshell, HPV causes cervical cancer. And if you can prevent yourself from getting HPV, then you can prevent yourself from getting cervical cancer. And even if you do have HPV, as long as you're getting screened regularly, seeing your gynecologist, getting the appropriate tests, this is a very slow growing disease, very slow growing cancer. It takes years and years and years to even get it. So it gives us a lot of chances to get treated even before it gets to that stage. Okay, so let's move on to some other questions that we have. Let's see. What else do we have about cervical cancer? I know. Okay. Well, while those questions are coming up, okay, here we go. What are the different types of cervical cancer screenings, and how do they work? So we just talked about how cervical cancer is entirely preventable, and we actually have a screening test. Did you know that we only have 4 cancers that we screen for in the United States? And I don't know if you guys know what they are, but There's only four. So there's breast cancer, there's colon cancer, there is cervical cancer, and there's prostate cancer for men. Only four, which is kind of insane if you think about all the types of cancers that are out there. Um, and so for cervical cancer screening, this has changed over time. So some of you may remember, oh, you had to start when you were 18. Or some of you may remember, oh, I had to start getting screened when I was first sexually active. But the latest guidelines are that you don't start screening until age 21. And so you could be sexually active before that, or whatever the case, we do not screen until 21. And it's not every year. It used to be every year. So many people are still confused about the frequency of it. So here it is. You start at age 21 and you get screened every 3 years. And then when you're 30, we add in HPV to the test. So from 21 to 30, you get the pap test where we put the speculum in, scrape a few cells from the cervix, and send it to the lab. So that's the testing. After 30, we add the HPV, and after that, you can actually, if that's all negative, you can actually go every 5 years without screening. Now, in my practice, I find that a little scary to go 5 years. So we still do 3 years. So we do every 3 years for everybody starting from age 21. And now, of course, we will do it a little more frequently if you do have HPV or you have high risk HPV or you have abnormalities. But if everything is going well, it's every 3 years. And then when do you stop? You stop actually at 65. Many are shocked by this. But we stop at 65 if your past several PAPs have been normal. So if your past 3 screenings have been normal, then we stop. Now this changes again if you have new partners, multiple partners, all of that. Every case is individualized, but I wanted to give you a general guideline of when we start and when we stop. And so the types of screenings are the pap test, which is again the scraping of the cervix of some cells, or you can actually just do HPV screening, which is also a swab. And we have a self swab actually now available. My practice offers it in the US and in California, and that's super easy. Patients can do it themselves. You just put in a swab into the vagina, twirl it around for 20 seconds, give it back to us, and we send it to the lab. Super easy, avoids the whole speculum. Many women are scared of the speculum. They, have a history of trauma or fear or shame or just anxiety about it. So no worries. You can just do the self swab. So the important thing is there's so many ways to get screened, and it's really important to get screened. Okay. Yes, and we definitely offer it at La Miranda Gynecology, and I've had about 3 or 4 patients do it this last month, and they love it. They've been putting off their GYN exam for years because they've been so scared to come in, and this is just an easy way to do it, and you can still get your cervical cancer screening. Okay, so let's move on to some other questions. So how often, we just covered this, how often should women get screened? It's about every 3 years. We start at 21, every 3 years, all the way up to 65. And sometimes we do screen a little more frequently if you have an abnormal test. And when you stop at 65, it doesn't mean that you stop going to the gynecologist at 65, by the way. I find that many women equate going to the gynecologist with getting a PAP. But actually, that's you still continue going to the gynecologist because you need a breast exam, you still need a pelvic exam. We discuss hormones. We discuss so many other things that pop up after that age range. So even though we don't screen for cervical cancer, you still should keep up your yearly visits. Okay, what else do we have? Okay, so what is the self swab option? I talked a little bit about it. The self swab is a simple swab that the patient just uses in her vagina. You put it in, you twirl it around for 20 seconds, and we send it to the lab. So you do it. It's not available at home right now, so you have to be at a healthcare facility. And it is a screen only for HPV. Okay, so it is not a pap smear. It is not a pap test. We're not putting a brush in and taking cells from the cervix. This is a screen only for HPV, which is a perfectly acceptable way of cervical cancer screening. Because if you remember, my very first point was what causes cervical cancer? It's HPV. And so this is a test for HPV. And if you do have HPV, high risk HPV, then we'll talk about, other tests that we do, colposcopy, other things to make sure, nothing is actually going on in the cervix. But this is a quick and easy screening test, and it's totally acceptable. Okay. Do we have any other questions? All right. So, are there any warning signs of cervical cancer that women should look out for? Cervical cancer or pre-cancer, as I previously mentioned, it takes a long time for pre-cancer to actually become cervical cancer. So it's not a 1 year you don't have cervical cancer, the next year suddenly you have, invasive cervical cancer. It's a pretty slow disease. So there can be some warning signs, including vaginal bleeding or bleeding after sex. That can sometimes be a sign of that. Pain, pelvic pain, abnormal vaginal discharge. So these are all things that should be evaluated by your GYN. Okay. Do we have anything else? And do we have any questions? Okay, so that was essentially cervical cancer screening in a nutshell. Please, if anyone's watching and you have questions about HPV and cervical cancer screening, please post it. I'll also talk about a couple of other things that I do in the office frequently when it comes to abnormal PAPs. So first of all, in our office, we do have extended genotyping. And so I've become very passionate about talking about this in the last year. Not all HPV tests are equal. So if you get a swab from a traditional lab, it may just say, you have high risk HPV or you have low risk HPV. That's all. And maybe it'll separate out a couple of strains like 16 and 18. But there's an extended swab. It's called extended genotyping. I spoke about it at the American College of OBGYN conference just last year, where this swab actually breaks down all the strains of HPV. So you're just not knowing if you have high risk or low risk. You're going to know, do I have strain 31, 33, 16, 18, 45, 52, 59? Like you'll know exactly what you have. And this is very, very helpful for tracking what's going on with your body over time. So next year when you do your PAP, do you still have the same strain or do you have a different strain? And whether you have the same strain or a different strain means different things for your risk of cervical cancer. So it's really important to do extended genotyping. And again, that's something that we offer in our practice in Lafayette. But that's something you want to ask your office, your GYN office, like, hey, do you guys do extended genotyping? And this is really critical for people who've had HPV for years, or they've had multiple partners. They don't know who gave them what. They don't know, which strain came from where, and they really want to keep track of it. So it's something to think about. And then Yes. Okay. We have a question. If you've been vaccinated for HPV, how does that change risk? Great question. So vaccines, the vaccine for HPV covers 9 different strains now. Before it used to be 4. The non-valent vaccine, or the vaccine that covers 9 strains, is the only one available in the United States right now. And this protects you against the high-risk strains of HPV. So you're going to get a lot of protection from this. So make sure you get the vaccine. The vaccine is approved from ages 9 to 45 for both men and women. So for everyone listening out there, your partners, your sons, cousins, friends, male friends, everybody should be getting vaccinated up to 45, FDA approved up to 45. So this can give you a lot of protection, but it's not foolproof. Because HPV is a virus that is mutating over years and the new strains come up. And so it's not foolproof. You still want to be, practice safe sexual practices, and you still want to be careful, but it does give you a lot of protection. So make sure you get your vaccine. And then another one that comes up also is people will say, like, I got the vaccine, 20 years ago. Now that there's another vaccine, should I get it? The answer is no. It is not recommended to get the non-valent vaccine, because even the one that you got 20 years ago still covered the main the most high risk strains of HPV. Okay. Anyone have other questions? Um, yeah, follow me at the Fibroid Doc on all social media handles. Tag a friend for this information, somebody that is suffering from HPV or had an abnormal pap. In my office, I see that it definitely creates a lot of anxiety when somebody has an abnormal pap. Oh my goodness, am I going to get cervical cancer? Do I have cervical cancer? So it's something I end up talking a lot about with my patients, and I think there's a lot of misinformation as well. So hopefully we've cleared up some of those during this live. And if you're in the East Bay, if you're in the Bay Area in California, and if you don't have a gynecologist and you're looking for someone to spend time with you, go through all of this, answer questions, and maybe you want the extended genotype. Maybe you've always just had the abbreviated HPV test that says I'm high risk, I'm low risk. You don't really know what strain you have, and you're interested in doing that. Come and make an appointment at my office. We're in Lafayette, California. We'll post the information below. And I'll see you next Thursday, and we'll have a little more chai and chat about more GYN topics. All right. Bye, everybody.